Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
Hello everyone, welcome to our special segment on women's health. My name is Aditi Gangal and I'm from THIP Media. Our topic for today's discussion is early menopause. Today we have invited Dr. Anita Gupta, a renowned gynecologist who is currently working as Associate Director at Fortis La Femme, New Delhi. Hello Dr. Anita, I welcome you on THIP Media's show Health Files. So, ma'am, as you already know, that today's topic of discussion is early menopause. So, please let us know about this health condition. What exactly is early menopause?
Yeah. So, Aditi, thank you for calling me for this. So, first of all, I'd like to explain what is menopause. Menopause, what is exactly it means? It means that your ovaries stop functioning, which means they stop producing the hormone and they stop producing eggs. And gradually, your periods also stop, and that situation is called menopause. The average age these days for a normal menopause is 51 years. So now, before that, if you get menopause, it means early menopause. So early menopause, we say when your menopause occurs before 45 years, and we have another category besides that, which we call premature menopause, which is when you get a menopause before 40 years of age. So it's not very uncommon, but yes, we do see patients with either a premature menopause or an early menopause.
Okay, ma'am. So, ma'am, why it is becoming so common these days? Like, what can be the potential causes of early menopause?
Aditi, I won't say that it's becoming very common. The thing is that this age of 51 years is now thought to be normal. Few years back, 45 years was thought to be a normal age for a menopause. So maybe with the advancement of the human body, this age group has gradually increased. So originally, when the woman used to have the menopause before 45 years, we used to say it's normal. But now we say it's early menopause. So that's why the incidence, I can say, is increasing. One. But yes, a few factors like your lifestyle, you are having more junk food, there are more pesticides, there's a lot of pollution, and of course, the smoking has increased in women. That can be one cause because of which slightly there's an increase in this early menopause.
Okay, ma'am. So, like these are the causes, and I guess are these the risk factors as well, or the risk factors of early menopause are different?
Risk factors, if you talk about risk factors, smoking can be a very big risk factor, but lifestyle per se, I don't think really affects it so much. Risk factors are not. If we talk about the causes usually are, there's a genetic predisposition. Like there'll be a history that the mother or the sister or the aunts have had a early menopause. So in those women there can be a incidence of early menopause. So, and if we can, if you want me to discuss the causes also, so the other common causes are that some endocrinological problems in the woman can lead to early menopause, and thirdly, sometimes there's a cancer there in the lower area, in the pelvic area, and you have a chemotherapy or a radiotherapy for that. That can lead to a early menopause.
Okay, ma'am.
And fourthly, of course, if you have had a surgery for your ovaries, in which the ovaries had to be removed, then obviously they'll reach to you'll get an early menopause because of that.
Okay, ma'am. So, ma'am, I was coming on this question only while like researching on early menopause. I came across a lot of articles that have linked early menopause with conditions such as osteoporosis or heart disease. So, ma'am, like, are there any long-term health risks associated with early menopause, like osteoporosis or any
Yeah,
health?
yeah. So, what happens? A woman has this hormone called estrogen, which is normally formed by the ovaries, and that's very important for our body. So, once you get menopause, the estrogen production reduces.
Mhm.
So that's once that reduces your, you can get osteoporosis, you can get a heart disease, and skin problems, hair problems, all those. So
Okay.
if you get your menopause at the right time, your body gradually gets into that menopausal phase, and still women get those sometimes these problems. But if it's an early menopause, definitely there are more chances of getting all these problems.
Ma'am, with this question, please shed some light on the specific signs and symptoms that are associated with early menopause.
Okay, so first of all, the menstrual irregularities, which means that she may start getting delayed periods, only spotting during menses. That is the first sign. So when they come to us and we do a physical checkup, or we do an ultrasound in which we feel that the ovaries may be smaller than what is expected, then we go for certain hormonal tests to prove that, okay, is it something else or it is menopause. And the other things, the woman may start feeling those hot flashes, night sweats, which shouldn't be at that age. If all that is accompanied with the menstrual irregularities, maybe she's going into a early menopause.
So, like, ma'am, how early menopause is diagnosed, basically? Like, is there
So as
any
I was,
way?
as I mentioned just now also, first of all, we do a physical checkup, we do an ultrasound, and to confirm that it's early menopause, we do hormonal test for a hormone called FSH and LH. And if we find that yes, it is coming into the category of menopause, then we of course repeat it after a month, and it confirms that yes, it's a menopause.
Okay, so ma'am, like the diagnosis process will be same for early menopause and menopause. Like the steps will be the same.
Yeah, that's it.
Okay, ma'am. Okay, so like, ma'am, once this condition is diagnosed, what will be the treatment?
So, in most of the patients having a early or a premature menopause, probably will have to give hormone replacement therapy. But although it's very safe these days, we have low dose hormones. But what I personally follow is I don't immediately jump on hormonal therapies. I tell them to have a healthier lifestyle, which means they eat healthy, they have an exercise regime, and they increase soya products and milk products in their diet. And we see if the symptoms start coming or increasing, then of course then we have to put on them on hormonal replacement therapy. We have to put them on that.
Are there any preventive measures that women can take to reduce the risk of early menopause? Because, like you've just explained, that like lifestyle is not very much associated with early menopause, but still, like, are there any preventive measures that can be taken?
Preventive, I think I can just mention that smoking should be,
Yeah.
reduced or stopped. That is one major risk factor. Secondly, if there is a family history of early menopause, we can't prevent it, but we can be aware of it. Said so that the moment you start feeling that maybe I'm going into early menopause, you just go to a gynecologist and get yourself checked so that your hormones, if you need to a replacement therapy, started and well in time. So nobody can prevent a menopause. We can help in treating them for the symptoms and the problems that are associated with that.
Okay, ma'am. That's quite informative.